This Good to Go segment is sponsored by Corewell Health.
So, you've been struggling with hip pain for quite some time now and trying mightily to just deal with it rather than face a difficult surgery up to and including a total hip replacement. Well, the orthopedic team at Corewell Health will explore every option before jumping right into surgery. Here to talk about finding the right path to recovery is Corewell Health orthopedic surgeon Dr. Clayton Perry. Hi, Dr. Perry.
Hi, how are you?
I'm doing well. Thank you for joining me. How does someone decide if a total hip replacement is right for them?
So, most of the time, people have had hip pain for a long time, several months to many years. And when it gets to the point where they really cannot deal with the pain they're having when attempting conservative management options, that's when we start more seriously considering total hip replacement surgery.
So clearly it varies from person to person when that right time is.
Absolutely. Some people may have very mild arthritis and have severe pain. Other patients may have very severe arthritis that have only mild pain. And in those cases, we wouldn't want to do a hip surgery for somebody that's not having a lot of pain.
And so in every case, I know that you try many things up till that
Yep.
last choice, which is the total replacement of the joint. But what are some of the stops along the way that you use to try to avoid that?
That's a great question. So, one of the things that we really want people to do is make themselves as healthy as possible. So, things like a healthy diet, maintaining a healthy body weight, and getting lots of physical activity are a great place to start. If patients have arthritis and have been doing all of those things, then we might talk about adding in an anti inflammatory therapy, such as an over the counter or prescription medication or potentially things along the lines of intra-articular steroid injections, which means we put a steroid injection into the joint.
Hmm. So if you come to that decision that replacement is necessary, talk about that process, the start to finish, what that looks like.
So once we've shown that you have severe arthritis by x-ray, and we've shown that unfortunately a patient might not improve with the conservative options, if the patient is experiencing limitations to their activities of daily living, for example, they can't walk or they might not be able to sleep because of the pain, that's when we really want to start more seriously considering the hip replacement surgery.
Hmm. And so then what does the surgery do? You're actually putting something artificial in there?
We do. So the way that I like to explain it, the hip is a ball and socket joint, and we make an incision, and then we get into the hip joint itself, make a cut in the bone, and actually remove the femoral head. That gives us access to all of the parts. We implant a stem with a new ball or head on top, and then we resurface the socket, which we call the acetabulum. We put the ball back in the socket, and 99 times out of 100, people have little to no pain after the surgery.
And what's recovery like then? Are they back up and at 'em immediately?
So, as far as recovery is concerned, the first few days and the first few weeks can be a little bit challenging, but most of the time, those things settle out very quickly. And patients are able to resume their normal activities after approximately 6 weeks, sometimes 4 weeks, depending on the way that we do the hip replacement.
I imagine that you've seen a lot of people have some pretty incredible outcomes after the surgery.
Hip replacement is absolutely my favorite procedure to perform, simply based on the fact that, yes, I see patients about 6 weeks after their surgery, and the vast majority of them cannot believe how much better they feel, how many more activities they can participate in. They all tell me that they feel like they've gotten their life back.
Wow. And wondering why they waited so long in a lot of cases, I'll bet.
That's what the vast majority of patients say. Once they see how good they are, they wonder, why did I wait this long?
Yeah. Oh. Well, folks, for more information about total joint replacement, visit spectrumhealth.org/every step. We will put a link to that on our website, 13 com. Dr. Perry, thanks so much.
Thanks very much for having me.